Hello, everybody, and welcome to our latest Ask the Leaders Facebook Live. You're really welcome. I'd firstly like to thank the panelists who have taken their time to join us this evening. Also, anybody watching live or likewise, if you're watching the replay of our Facebook Live afterwards, we hope that it's going to be useful for you. If you haven't watched one of our Facebook Lives before, and we've been doing them pretty regularly now, some residents have already submitted questions that I'll be leading the panel through, and thank you to those residents that have taken the time to submit questions to us. But if you haven't yet and you do have a question, do use the comment section on our Facebook page, and I will try my best to bring in any extra questions or comments that you make. And if for any reason we can't cover all of the topic areas today, do still leave comments on the Facebook page, and our comms team will do their best to respond to you during the call and also afterwards. And then tomorrow, there's another Facebook Live, which is with Councillor Smalley, and it's looking at colleges and universities and their safe return to the city. So there's another opportunity to ask your questions there. Today, though, is very much focused on public health, and I'm really pleased to be able to be joined by representatives, including from our public health team, councillors, and also from Make It York. But I'll go around and make sure that each panelist introduce themselves to you shortly before I start going through the questions. Just a few opening comments from me that I hope will be useful. We'll know that we'll be discussing today the new three-tiered restriction system that was put into place only yesterday by the government, and also our response in York. And obviously we're going to take a closer look at public health, the latest data in York, and also the guidance that we're putting out to communities and businesses in the city. York yesterday was placed into the new medium level of the new three-tier system, and that was outlined by the Prime Minister. And this means that no additional restrictions beyond the current national guidance are in place for York's residents and businesses. But we must remain vigilant and work together to keep our city safe and open, because, as I'm sure will be outlined to you later, infection rates in the city are rising, and they are rising above the national average, as we have seen in other cities and other parts of the country. And the world around us shows that we cannot be complacent about that level of risk and what that means for the future in our city. I know that our public health team, and Sharon will outline this later, continue to closely monitor the data and the spread of the virus, and we'll get a bit more of a detailed update on that. The year, I know, has been exceptionally difficult for many, and I'd just like to say how grateful I am to residents and businesses who are doing their bit in protecting our city, their families, and our communities. Certainly as a council, we're going to continue to work with all of our key partners, not just across the city, but also across the region. And one of the things that includes is really calling on the government to deliver further crucial improvements to the track and trace system, more support for local businesses, as well as more effective communication and partnership between local government and central government, and in particular those public health experts who need to be able to do their jobs to protect our communities. Despite the challenges of the year, York has demonstrated what it does best, which is coming together and supporting each other in following that guidance, volunteering, and looking out for one another. And it's absolutely crucial that we continue in this spirit, and I know that we'll continue to work together over coming weeks and months. With that, I will then stop, and I'll gradually ask the panel to introduce themselves. So in no particular order, Sharon.
Good evening, everyone. I'm Sharon Stoltz, and I'm the Director of Public Health for the City of York.
Thanks, Sharon. Sean.
Good evening, everybody. I'm Sean Bullick. I'm Managing Director of Make It York.
Thanks, Sean. Carol? You're just on mute. This is where we can tell it's a Facebook Live event, just to prove that.
Right, I'll start again. I'm Councillor Carol Runciman. My portfolio is adult social care and health, and I'm also chair of the city's Health and Wellbeing Board.
Thank you very much. And Darryl.
Last but not least, I'm Councillor Darryl Smalley, and I'm the Executive Member for Culture, Leisure and Communities at City of York Council.
Thanks very much. And if I probably didn't introduce myself at the very start as well, so I'm Keith Aspden. I'm the leader of City of York Council. So as mentioned, we've got a number of questions, but I thought what would be really good at the start of this with that public health focus is to ask Sharon to really give us an update of the current situation, the data and what we're doing in the city, particularly in light of yesterday's government announcement. So over to Sharon.
Okay, thank you, Keith. So what I'm going to do is share some headline figures with viewers this evening. If people want more detailed information, then you can either contact the public health team directly. There, we have a generic email, which is inquiries.publichealth@york.gov.uk, or you can also access the York Open Data platform. So just to start then, I want to say something about figures. So we've had a couple of queries come through from residents who have asked why the figures that we are tweeting and sharing daily as a council are different to the published figures that people might access on the BBC website, for example. One of the reasons they're different is that, as Councillor Aspden said at the start, we have access to local data that national bodies such as BBC may not have, and we monitor that data on a daily basis. So what we tend to tweet and share is what we call unvalidated local data. So that's data that we have access to, and that I have access to as Director of Public Health, and that the Council may has access to. That is not yet cleaned up and validated through a national process. So it means that our local figures are subject to change, which we always put that caveat in there. And the reason that is because there's sometimes a time lag with data coming through, and you'll see that as I start to go through the figures. So as at the 12th of October, York has had a total of 2,095 confirmed cases of COVID-19 in our population. So that is a total since March. That gives us a rate of 994.7 per 100,000 population. This is above the national average. So the national average is 934.6. So York's rate is higher than that, but it's below the regional average. So the regional average is 1,328. And that's really because most of viewers will be aware that there are places in South Yorkshire and West Yorkshire, for example, that have higher rates of COVID than we do in York. So higher than national, but lower than regional averages. When we look at the 7-day rolling average of cases, we tend to use that because the number of cases on a day-to-day basis that can vary quite a lot. So we tend to smooth out that daily variation by talking about a 7-day rolling rate. So our local data tells us that for last week, the last 7 days up to the 10th of October, the rate of confirmed COVID cases in York is 206.06 per 100,000 population. That again is higher than the national rate and lower than the regional rate, slightly lower than the regional rate, which is 217, just over 217 per 100,000 population. So just to put that in some context, in the last 24 hours, we've had 95 new cases of COVID go onto the database for York residents. So when we're then looking at the number of tests that are being undertaken on York residents and the number of those tests that are coming back as positive, what we can see is that in addition to the numbers of cases of COVID going up, the positivity rate, so that's the proportion of tests that are tested positive, is also going up. So our positivity rate is higher than both the national and regional averages. Our rate is 13.1% and the national rate is 7.6 and the regional rate is 11.1. So that shows us that even though some people have argued, well, of course the number of cases is going to go up because we're testing more people than we were testing in March, what we can see is that positivity rate is high as well, which gives us, or gives me and my team, a very good indication that this is a real increase in terms of how much COVID is actually circulating in our population. When we then look at what impact that's having in York, so I get lots of questions about care homes and schools. So at the moment, we're working with 6 care homes that have active cases of COVID. That's actually a small proportion of the number of care homes we have within the CYC boundary, and I'm very proud of the work that our care homes have done to ensure that they're COVID safe. And there's a lot of work that the Vale of York CCG community nursing teams and council staff from adult social care and public health supporting those care homes to ensure they're COVID secure. We regularly test both staff and residents in care homes, so it gives us a very accurate picture of what's happening in our care homes, so I can reassure viewers of that. And then at the moment we're working actively with 4 schools in York that have active cases of COVID. We've done very well in York in terms of schools. We haven't had any whole school closures. Again, there's very close working between schools, the education services team within the council and my team. We are able to respond very quickly when schools contact us about positive cases, and we're able to work through what we call the COVID risk assessment, and we can make decisions about who close contacts are, and then ask those close contacts to self-isolate. So we've had a number of occasions when we've needed to ask bubbles of children to self-isolate, and we're continuing to very closely monitor that. The other impact then we look at is hospital activity, which gives us, or gives me and my team, a good understanding of the severity of the COVID virus in York. Viewers will know that some people will experience quite mild symptoms or may feel as though they have a flu, but it's people who are either in the older age group or already have underlying health conditions that we know are most at risk. So we monitor very carefully hospital admissions as well. The number of people in hospital has been increasing. It's been increasing steadily in York over the last 2 weeks. There's always a time lag between people testing positive for COVID and then them becoming very sick, if that's what's going to happen, and they require hospital treatment. So even though we saw our case numbers of COVID in our community starting to rise early in September, we've only more recently, over the last 2 weeks, really seen an increase in hospital patients. It takes a little while for the hospital data to come through. So the most recent data I have is the 11th of October. And on that day, there were 23 York residents in York Hospital, but I'm sure the numbers will have gone up slightly since then. The other thing that we monitor is where cases are happening. So viewers might have read in the media that in some places they've seen a rapid spike in cases of COVID linked to large outbreaks, in particular installations, meat or food factories, for example. That's not the picture that we're seeing in York. What we see in York is widespread community transmission. So when you look at a map of York and you look at where the cases are, they're spread all over the city. We haven't seen large outbreaks in our businesses either. What we're seeing is transmission of infection through social contacts and through spread in households. No particular hotspots are jumping out at us in relation to that. And we also monitor deaths. And when we were, or when I was reporting in these sessions earlier in the year, I was reporting that we were seeing quite a significant number of excess deaths at that time, which peaked at the end of April, early May. I'm very pleased to say that we're not seeing that picture currently. We've had one reported death from COVID in September, and I'm aware there are 2 more in the system that are yet to come through. So every death is obviously a really sad loss and a tragedy. But I'm pleased that we're not seeing the high number that we saw earlier in the year. As Councillor Aspden has already indicated, we were notified yesterday that York has gone into tier 1 in terms of the new COVID tiers. That means that we're subject to national restrictions. And so the key message that I would want to give to residents are to still follow rigorously the rules of hands, face, space. So that hand washing, if you're out and about, carrying hand sanitizer with you, use it regularly. You can get small bottles, they can fit in your pocket or into a handbag, so carry them with you, use them regularly. Wear face coverings. You have to wear face coverings in shops and on public transport and some enclosed public spaces, but I'm strongly encouraging all residents to wear face coverings in any space, public space where you're mixing with people outside of your household and you can't preserve those 2-meter distancing. So wearing of face coverings, dispose of them safely. We're having stories of face masks being just thrown away in the streets of York. Let's not do that. That's not, it's very distasteful to see discarded face masks, but obviously they're an infection risk. So please dispose of disposable face masks safely, either in a bin or put them in your pocket or your handbag and take them home and dispose of them there. And for reusable cloth face coverings, wash them regularly. You shouldn't wear one and then use it on another day. Wash them regularly, either with warm soap and water or in a washing machine with the rest of your shopping. Washing, sorry. So I'll stop there, Keith, if that, you can tell us live, can't you? I'll stop there, but I'm sure there'll be further questions that I'll need to respond to.
Thank you very much for that really useful update, Sharon. And I can see that questions have started to come on the Facebook Live page, which is really appreciated. And where possible, I'll try and group questions together that are coming in. And the first question that we received in advance of the meeting was from Clive, who asked, and this was about the test and trace system. I was wondering if York has its own track and trace system. This must surely be one of the most effective tools in the box to beat COVID. But if I could add a couple of supplementaries to that. So on Facebook Live, Richard has asked what improvements are needed in test and trace. And also, shouldn't the city be able to decide its own course of action rather than calling on the government? So if I go to you first, Sharon, on what improvements could be done nationally to the system, and what are we doing in York, and then I'll bring Carol in. Sharon.
Okay, thank you. Very useful questions. So the improvements that need to be made to the national test and trace service, I won't call it NHS because it's not delivered by the NHS, it's delivered by commercial partners, is that it needs to work. And it needs to work very effectively. And what we know at the moment is that only about 60% of positive contacts of positive cases in York are being traced through the national system, and obviously that isn't good enough. If we're going to be able to halt the spread of infection, that needs to be as close to 100% as we can possibly get it. There also needs to be timely reporting of test results. So people need to be receiving their test results within 24 hours, so that they know if they're positive, and that they can start preparing information about people they've been into contact with. And there needs to be very timely contact then of the contacts of those individuals, because there's a very clear 48-hour window to try and identify those people that are at risk of infection, to ask them to self-isolate, and then to request a test if they develop symptoms. Need to just be very clear on that. If you have been contacted and you're told that you have been in contact with a positive person and needs to self-isolate, you do not need to request a COVID test at that time. All you're being asked to do is self-isolate. It's only if you develop symptoms of COVID that you need to request a test. And that's so that we can ensure that the tests are actually targeted to the people who need them most. So that's two things really. People need easy access to a test. They need to get their test result quickly within 24 hours, and their contacts need to be identified and contacted within 48 hours. And the national system is falling down on a number of those counts at the moment. In terms then of what we're doing locally, we have been lobbying the government for some weeks now for us to be able to set up our own test and trace service to run alongside and complement the national one. We received approval to set up our own system just over a week ago, I think, possibly 2 weeks ago. But we have to then ensure that our staff are trained to be able to use the national system. So even if we're doing our own local contact tracing, the test results are entered into the national system. So we've had to train our staff to be able to know how to use the national system. We've had to put the appropriate data protection systems in place so that we can ensure that information is being shared in accordance with data protection rules and held in accordance with data protection rules. So we've been working on that. And obviously we need to have sufficient staff to be able to do the contact tracing as well. So over the last week or so, my team have been working very hard in putting all of that in place, and we plan to be up and running with our local contact tracing service from Tuesday next week. We only have capacity to do a Monday to Friday service next week, but we're out to advert at the moment, so please check the council's website if you're interested in coming to work for the council to support our contact tracing efforts. We're out to recruit some more staff, and once we have those staff in place and are trained, we plan to be able to offer that service 7 days. We are having to do this with minimal additional resources from government. We've not really been given the resources that we would like, so we're a bit limited as to what we can do, but we'll certainly be working hard to put a robust contact tracing service in for York that I'm sure will be a valuable addition to our efforts as a whole city to be able to control the spread of the virus.
Thank you very much for that, Sharon. And I think we'd all agree that the drive-through centre at Poppleton Bar, the new walk-in centre are welcome, as are all of those local efforts to supplement that national system. But for me, it's always been about the government has known for a long time now, since March, that this was going to be a fundamental part of the response, and we still need more testing capacity, in particular more laboratory capacity, to make sure that there aren't backlogs, and then in places like York that you have enough walk-in provision to supplement that drive-through provision, and certainly I know that we'll continue to call for that, but also actively offer, and it's not just York, it's all of the Yorkshire councils that have made that offer to try and help to be able to supplement locally, because it's only if we do a real proper job of test and trace that we can really work together to protect communities and businesses. And Carol, did you want to add?
Yes, just a sentence or two, if I may. I think this has been a very, very frustrating area for us in the local authority. Our public health teams worked extremely hard, both with settings and with businesses, giving advice, with the public as well, with all the messages that are going out. And until we get it right and clear from the government, then it's been very difficult to sort that out. At one point, we had people going for a test who weren't symptomatic but wanted to get back to work. And the message obviously clearly hadn't gone home that you're tested if you are symptomatic. I think people understand that now, but the need for clarity and the need for investment from the government is absolutely crucial to getting test and trace right.
Thank you very much for that. with an eye on time, I'm going to make sure that we move on, but I'm sure we might come back to the topic of test and trace later. But we had another question in advance from Ben, which was about the city centre, and this was, will footfall into the city centre still be encouraged if certain businesses are told to close following the Prime Minister's announcement? And also, is City of York Council receiving grants from the government to help implement the new tier system? So I'm going to ask Sean to pick up that question about the city centre and footfall, and then Darryl on what support City of York Council is receiving. But then just to add in another question on Facebook, we've had a question from Sarah, which was, how do we plan to further improve the practice of social distancing in the city centre? So we might bring in others to pick up that point as well, but over to Sean first.
Thank you very much, Keith, and good evening, everybody, again. Just to pick up on Keith's point and indeed Sharon's point, York, obviously, as things stand, is on tier 1, so medium level alert, which means that businesses and venues can continue to operate in a COVID secure manner. Obviously, there are some restrictions around that in terms of licensed premises and that sort of thing. But sport can continue, exercise classes can continue, retail, etc. venues are open. So I think that in short answer to the question, York very much remains open for business. And we and businesses have made have tried very hard, made very significant efforts to make sure that can remain the case and is safe. We are not, in terms of the coming months, looking to market to consumers beyond the city. But we are very keen to bring, so long as it's safe, to bring residents back into the city and to use the city and to support local businesses and to enjoy the city. Yes, I mean, for the moment, certainly, footfall is being encouraged, but it is absolutely focused on local and resident footfall into the city centre.
Thank you very much for that, Sean. And I know from Sarah's question on Facebook, she commented that signage has been put up. And I know that in addition to that signage, you'll have seen new, bigger signs about let's work together to keep schools and businesses open have started to be put around the city. But we've also supplied Let's Be York packs to businesses and licensed premises, all about encouraging that behaviour in as much as possible. And I know that we will obviously continue to do that. And the Chief Constable of North Yorkshire Police was on a previous Facebook Live talking about enforcement action that the police can take. And they have, I know, in North Yorkshire Police issued a number of fines for those who continue to refuse to follow that public health guidance. So it's about encouraging, it's about asking people to work together. But there are sanctions that the police can use if people don't do that, so that everybody else is safe. But there was a second part of that question, which I'll go to Darryl on from Ben, which was, is City of York Council receiving grants to help them implement these new systems? Darryl.
Yeah, to answer Ben's question then, as Sean said, because we're in the medium tier 1 category, there isn't any additional support that's been made available to businesses beyond what's already been provided and beyond what we've already put out. Although I would say, obviously, we've seen that this changes at quite short notice, both in terms of public health restrictions or in terms of extra support that's going out. So I think just probably keeping an eye on york.gov.uk/coronavirus, and on there's several tabs, including business support, and probably just keeping that as a tab on your desktop if you're a small business, looking out for that. But if we do move into tier 3, then we would expect that the council and businesses would get additional financial support, and we're all set up ready. You know, we've seen that the council's in pretty close to the top in terms of getting money out quickly to businesses. And then I would just say, in terms of the earlier question, in terms of supporting local businesses, especially if restrictions change, I think we saw in the first lockdown, when it was restricted to essential businesses only, that actually we have such a great variety of, from food shops to greengrocers to bike repair shops. Actually, there's an awful lot of independent essential businesses out there in York. I mean, it's really important that regardless of what the restrictions say, that we get out there and support them.
Thank you very much for that. Now, quite a lot of the questions that are being asked on Facebook almost link to that, which is now that we've been put into tier 1 medium risk, and I'll read a couple of the questions out directly. So from Jason, given that cases are rising, are we prepared to be escalating to level 2 soon, or even level 3 very high? And similarly, earlier in the chat from Moggy, do we think we'll have another lockdown? So I'll go to Sharon on that question first, because I think it really does reflect on we're following the current guidance, but cases are rising in the city,
Yeah.
and obviously we need to do absolutely everything we can do to keep that down. And follow that guidance, because I know previously we noted that we might go onto an area of concern list. That system's changed, but if the cases do continue to rise, as we're seeing in those other places, then more restrictions would follow. But you're better placed than me to tell us about that, Sharon.
So So when the government is deciding which tier local authorities or areas might go in, with the previous system, it was based on individual local authorities, whereas with the new tiers published yesterday, what you may have noticed is that geographical areas have gone into tiers. So if we think about Yorkshire, North Yorkshire, which therefore includes York, has gone in at tier 1, West Yorkshire and South Yorkshire into tier 2. And then if you go on to websites, the BBC website, for example, or you go on to the government web pages, they will list the local authorities under those areas. And one of the things that they consider when deciding what tier to put people in is what's happening with the NHS. So if people think back to the lockdown in March, one of the reasons for that was obviously a concern about numbers of cases, the numbers of cases in care homes, the pressures on the NHS at that time, and a concern about excess deaths, etc. So when you look at some of those areas that have been put into tier 2, what you can see is significantly higher impacts on the NHS than we've seen in York. So yes, our case numbers are increasing. Yes, we want to, we need to halt that rise in case numbers and hopefully reverse it. But we're not yet seeing a significant impact on the NHS and on your hospital. So we don't really have much influence locally over what decision the government make about what tier we're in. How it works, which you might be interested to know as viewers how it works. So the Joint Biosecurity Centre will be reviewing all of the data. So they will be looking at York's case numbers, they'll be looking at the age pattern of those case numbers, and they'll be looking at the number of outbreaks we're having, and they'll be looking at impact on the NHS, on GP practices and the hospital. The Joint Biosecurity Centre then will make a recommendation to the National Cllr committee as to whether a particular area, so we're talking about York here, whether York should remain in tier 1 or whether we should increase into tier 2 or tier 3, which is based on the public health data, what we call the epidemiology. So Cllr will review all of that, and they will make a recommendation to the National Gold Committee, which has the Secretary of State and other ministers on it, including advisors from SAGE and the Chief Medical Officer and others. And that committee will then review all of the information that they have about York, and then they will make a decision at Gold whether we remain in level tier 1, whether we'll go into tier 2, and we'll be informed of that decision as an authority. We may be asked our views along the way, but it's not our decision. It's a decision that's made nationally. Referring to some of the questions I can see coming through on Facebook, there is a possibility that we go into tier 2, and we are prepared for that if that should happen. And we're having ongoing discussions with all of our partners, including with Make It York and other leaders across the city about what that might mean. So we have the plans in place for if we move to tier 2. I think it's extremely unlikely that York will move into tier 3. Our situation would need to get considerably worse before we got to tier 3. And with all the measures that we're putting in place, the additional measures that would be introduced if we were to go into tier 2 around stopping households from mixing, for example, then I'm confident that in York we'll be able to break that cycle of transmission before we got to tier 3. But obviously it's something that I continue to monitor on a daily basis, and through our briefings with our partners and with residents and all of our communications, we would certainly be alerting residents if we felt that there was any possibility of us going up to tier 3. So I hope that's helpful in terms of explaining how the process works.
Thank you very much for that, Sharon, and I'll bring Carol in.
Thank you, Keith. Just to add to that, we've done an awful lot of planning about what happens next, both in the council and with outside organisations. We've done scenario planning, which says if this happens, this is what we'll do. And if that happens, that's what we'll do. So we're well prepared for what might happen next, whether we stay the same, whether we go up. And residents need to be comforted by the fact that all the agencies are doing that. I read a report today from the ambulance service. They're doing planning as well for what might happen next. All the agencies are well on board with saying, yeah, it might stay the same, but it might not. And if it doesn't, and if it gets worse, this is what we'll do. So there's plenty going on in that direction.
Thank you very much for that. I think I just hope this time that the government communicates a little bit more quickly to directors of public health rather than learning what's happening on Twitter. And equally, one of those concerns as we look towards the end of the furlough scheme is about weighing that against obviously the impact on jobs, and we've seen unemployment begin to rise, and in particular making sure that northern towns and cities aren't left behind in that mix, which I know is a message getting across loud and clear. I'll probably come back to that point about support for businesses and employment, and bring Sean and Darryl in a bit, just to give you a warning. But one of the other questions that I'll go back to Sharon and Carol on that's coming on Facebook is from Howard, which is links to this conversation. How is York preparing for the health and social care winter pressure, and are we prepared to meet the demand for flu jabs? So if I go back to Sharon, and then I'll bring Carol in. Sharon.
Okay, so as Carol's already alluded to, there is a huge amount of planning going on across NHS and social care, but involving all partners. So I'm a member of various forums that are York-based, that are North Yorkshire-based, and also work that's happening across the NHS footprint around Humber, Coast and Vale as well. So if I say a little bit about what the North Yorkshire Local Resilience Forum are doing. The North Yorkshire LRF, the Local Resilience Forum, is the forum that meets to look at planning across North Yorkshire and York for all emergencies. So whether that is flooding, whether it's impacts of leaving the European Union, they look at COVID and winter planning, and that forum brings together all of the local authorities across North Yorkshire and York, so City Council, Nottingham, North Yorkshire County Council, the districts. It brings together York Ambulance Service, as Carol's already referred to, the hospitals who cover that patch, the clinical care groups, clinical commissioning groups that cover those patches, as well as the police, the rail police, British Rail Police. It brings together the Environment Agency, any kind of partner that you can think of that would have any involvement in emergency planning. That group meets together at least twice a week at the moment on Tuesdays and Thursdays. Other subgroups are meeting, looking at specific issues. And so we are as prepared as we can be for whatever emergency might fall upon us over winter, including flooding, which obviously is something that concerns us in York. In terms then of flu vaccine particularly, that program is running slightly differently this year, because the government has widened the number of people who are eligible for a flu vaccine to include healthy people over 50, whereas in the past it's been over 75s and people who are pregnant or with long-term health conditions, for example. The difficulty is that GP practices have to order their flu vaccines in March. And back in March, when they were ordering their vaccine, they ordered enough that they felt they would need for their practice population at that time. And obviously, they're now finding that that isn't enough. We've received assurances from government that they've ordered enough supply of flu vaccine for everybody who is eligible to have one. But there are some kind of logistical issues about getting that vaccine to where it's needed. So I'm hearing some stories of people who are struggling with being able to book an appointment for a vaccine at their GP practice, or they are trying to access a vaccine in a pharmacy and they've been told they can't have that yet. There are two possible reasons for that. One is that pharmacy or that GP practice is saving the vaccine supplies they have to make sure that they've vaccinated their clinically high-risk population first. And then when they've done those individuals, they'll open it out to healthy over 50s. Or it could be that they've used all of the vaccine supplies they had in September and they're waiting for further deliveries to arrive. So I'm not anticipating any difficulties with the flu vaccine programme this year. But some people might just need to be a little bit patient, waiting for their own particular GP practice to get their supplies in.
Thank you
I'll
very
just
much
add a
for that.
sentence,
Please.
Keith. Yeah. I went down to my local pharmacy a couple of days ago to promote the flu vaccine. And I had actually already had my flu vaccine earlier on, but they had enough there. And obviously the promotion that's going on is working really well, because a couple of days later, somebody else went down to the same pharmacy and they've run out. So anyway, they say they have stocks in again. And the most important thing is to call in, because in a pharmacy, you don't have to make an appointment like you do at a GP surgery. You can just walk in and get the flu vaccine. So if you're going that way, just drop in and see if you can get your flu vaccination.
Thank you very much for that. So on Facebook Live, we've had a couple of questions relating to schools that I'm going to bring in now. And the latest question we've had from Hilary is, does this make any difference when children are mixing in school and then children mix after school? But then we also had an earlier question on schools from Carl, which was, in school settings, why is it only close contacts that need to self-isolate and not whole bubbles and classes? And we know that schools, through the York Schools and Academies Board, are doing an awful lot of work to do everything they can to make the schools as safe as possible for that wider return of pupils. I'm going to bring Darryl in first, and then bring Sharon in on that one. Darryl.
Yes, not my portfolio, but my mum happens to be a primary school teacher, so you sort of hear about this every evening and every weekend. I think it's probably firstly important to say that every school, whether they're a primary school or secondary school or SEN or anything like that, every school deals with this in a unique way that best suits the basic students' needs and the needs of staff. I think, and all schools have procedures in place for dealing with both potential and confirmed cases of COVID-19 in school. If any child has symptoms, the parents will be asked to pick them up, or guardians will be asked to pick them up immediately, and they'll remain isolated in school until they're collected. If there's a confirmed case in a school, then the school will be advised by the health protection team on the actions that they should take. And again, sometimes that will be the bubble. Sometimes that, depending on the situation, will be a year group. But really, if you do have a student or a child and you're unsure in terms of what's going on, then do just get in touch or follow the latest guidance from that particular school. In terms of mixing outside, I know a particular bugbear of my mum as a teacher, when she releases the children in the evening, and I see it's reported across York, is that mixing at the school gates. And I think we all do an excellent job, whether we're going shopping or whether we're going for a meal or for a drink, of following the guidance. And I think it is quite easy, just in those big settings when there's hundreds of children flocking about, to forget and be a bit loose. So I think just making sure that when waiting to pick children up, you do sort of, most schools have got systems in place to make sure you can pick children up safely. And then in terms of mixing outside, I mean, just in my ward in Rawcliffe and Clifton Without, back in the summer, feels like a lifetime ago, but obviously it was reported in the media about various gatherings on Clifton Ings, and it's important, I guess, just to say that obviously children are people, and the rules are for people, and the rules aren't different in terms of whether you're 12 or whether you're 80, and making sure that gatherings are following the guidance. And I think if you do spot anything, then I know the police or the local PCSO teams, or indeed the council, are always happy just to politely point out the recommendations.
Thank you very much for that, Darryl. Now, I've had an eye on time, and I've just realised we've got 5 minutes left. Yet I wanted to cover more questions on business support. I wanted to go back to Sharon to talk about guidance in schools, and also talk about self-isolation support, but we're not going to be able to. So I'm sure that Darryl, who is chairing tomorrow's Facebook Live, might well have these questions on the list, so that some of those conversations can continue. And obviously, I know that we'll put out responses on Facebook. The one I did quickly want to get in was a question from Sabine, which was sent in advance, which was about self-isolation support, which was, my worry is the small percentage of people who are self-isolating. Recent surveys estimate that only 20% of people who test positive and only 10% of their contacts are self-isolating. What can be done in York to understand the obstacles and support for these people who are self-isolating? So I'll go to Sharon, but noting we won't have long to answer comprehensively, but I did want to get that question in.
So those are national figures. I haven't got actual figures for York, but we also collect quite a lot of soft intelligence. And we don't think this is a major problem in York of people not self-isolating when they've been advised to. But again, please do get in touch if you're aware of that. There is quite a lot of support that the council are putting into people who are self-isolating. We still have got the community hubs up and running. We still have quite a significant number of volunteers who are continuing to pick up prescriptions for people, are continuing to support people if they need support with shopping, social support to try and prevent social isolation. And we've been even having volunteers deliver letters of support to people who we know have tested positive on the national system and are self-isolating. That's not to say that there isn't more than that we can do. And I'm always interested to hear more from residents about any gaps in the support that we're currently providing. And then, of course, if you go to the council's website, there's information there as well about the national support now available for people on low incomes if they need to self-isolate. That's now been extended to the self-employed. And so there's a range of grants that are available. And again, there's information on the council's website about all of that support that's available.
Thank you very much for that, Sharon, and sorry for having to rush the questions at the end. Sean, I'm conscious I was going to come back to you on business support, but is there anything you either wanted to add on that or on about the work that Make It York's doing? I'll give you the last comment before we wrap up.
Thank you very much. Thank you, Keith. I think for in a general sense, I think what we're very keen to do over these coming winter months is, as we said earlier, to bring people in from across the city to support local businesses and to enjoy York for all that it has to offer. Over the last few months, we've spent a very significant amount of time on survival for businesses, so grants and that sort of thing, helping CYC with that, helping obviously on the recovery marketing. We've worked with a whole range of sectors on roundtable meetings to gather intelligence, which has allowed us to help lobby government seeking support. And then I suppose in the wider sense, we've continued our ongoing work around the priority of diversifying the economy and helping where we can with the development of York Central and that sort of thing. So it's been, on the one hand, business as usual, as well as, of course, the emergency COVID response. But I think just picking up on your point, Keith, earlier on, as a relative newcomer to York, very struck by the way everybody's pulled together and are supporting each other and working together to get through this.
Thank you very much for that. And I could almost then ask more questions about York Central, but our time has struck. So with an eye on that, I'd just like to thank again the panelists and those that have asked questions on Facebook and in advance. Really appreciated. Do keep asking questions or commenting on Facebook. And as I say, we'll make sure that we keep responding to those, or you can join in with tomorrow's Facebook Live, which is 5:30 to 6:30 on the council's Facebook page. just to finally say from me, as we've said throughout this call, we need to work together to keep each other, our families, communities, and the city safe. Just thank you for joining us, and I hope you will join in on future Facebook Live calls. Thanks, everybody. Bye-bye.